we have about 1,000 judges that really leverage and use this last piece of information to make their final decisions on who is the best of all the companies that have applied. And we've had over 1,000 applications this year. And this is the first year we did the Surgical Transformation Award. Why? Because it's really freaking important, and we never had this award. And the great work that DOCSF has done, which Stefano will get into, has helped us think about how to launch this and think about companies that are making a dramatic difference in healthcare, in hospitals, in clinical settings to get people that much better, faster, and of course, cheaper. What we do is we award companies that are making a difference, that are scaling and growing. These are real companies that are at the forefront of change, and the winner will get first time we've named it our Digital Healthy Award. It's our Oscar. We sort of made it look a little like Oscar, but we have the Dr. Snake thing, and we're really excited about this as a new tradition this year. So really, again, and before I hand it out to Stefano, again, what we're looking for you great companies to do is really tease it out why you're different. What's your superpower, and what job are you really replacing? And with that, I have the ultimate pleasure of introducing the one and only Dr. Stefano Bini.
Dude, I gotta have you talk to my wife. Hey, listen, that was great. Thank you so much. Pleasure to be here. Excited for to see some old friends like Yvonne and Justin, and meet some new ones. This is an extraordinarily important category. You mentioned the Digital Orthopedics Conference in San Francisco. When we launched it 7 years ago, it was to bring a focal point to the question of how to apply all these digital technologies that are available to us in healthcare into a use case. And it just so happens that MSK, or musculoskeletal care, is a very large use case. And so it was allowed us to create a conference so people had to really look at that last 100 yards. We're going to take this tech, how do you make it happen? But the technology itself that we look at DOCSF can be applied to any surgical field, because the problems are very similar. Obviously, there's minor nuances, but on the whole, the ability to apply technology into healthcare and to solve problems are relatively consistent across the surgical field. So as you mentioned, we've been partnering the last couple of years to cross-fertilize the Digital Health Hub Foundation and DOCSF and create some cross-pollination of ideas. And that brings us to the awards. And congratulations to all of you for making the final cut. And would love to give you guys the opportunity to explain why you should be the winner of the health, what'd you call it, Mark?
Basically, surgical transformation. You've given me an opportunity to interrupt you, so I'm going to do it my final time. One of the things that we are doing this year is we were really lucky to have McKinsey and Company help us and support us on these awards. McKinsey's going to give a perspective of what makes a great company. And we're going to hand it off to the folks from McKinsey. They've got a great slide for this. And this is going to be a really good setup for what, as Stefano gets in and basically manages the question and answer period. So with that, McKinsey, take it away.
All right. Hello, everyone. It's a privilege to be here with you all as a knowledge partner. My name is Sarun Charumilind, and I'm a doc and also a partner leading our client work at McKinsey at the interface of payers, providers, innovators, and startups who work together to improve access, quality, and the sustainability of healthcare. I'll take just 2 minutes to share a brief perspective on, how we think about what it takes to create winning businesses based on our work with over 1,000 startups and scale-ups globally, including 250 unicorns and many long-term healthcare partnerships to accelerate growth and valuation. From this experience, we've learned again and again that the 10 timeless tests of strategy can help to pressure test the strength of a startup strategy as well. We've highlighted 6 of these for you to consider, but just to give you a flavor of a few, will it beat the market is comprehensive. The remainder break down the elements of a market-beating strategy. So the first test aims to identify how your strategy is different and better to avoid the pitfall of just playing along with market forces. The second is around scarce resources. Too often companies and strategies are unclear about the specific special capability that is critical to their success. So this question forces the discussion around what is the special sauce? Is it privileged assets like a patent that can be bought and sold, or a distinctive competency which cannot be easily traded, like speed to product launch, but still confers a competitive advantage? And the third is about the granularity of where, not how, are you competing? Our research has shown that 80% of the variation in revenue growth across companies is explained by choices about where to compete, with the remaining 20% explained by how. So does your strategy outcompete others by identifying and allocating investments to the most attractive subsegments? So that's just a flavor of a few. As you evaluate strategies, we'd encourage you to ask yourselves, how many of these tests does this strategy pass today? With that, good luck to all the leaders and entrepreneurs here, and super grateful for your passion and dedication to improve healthcare. And I'll hand it back over to Mark and Stefano.
Great. Stefano, it's all you. Thank you, Sarun. That was fantastic.
Yes. So, I have a little cough, so I'm trying to mute my microphone. I couldn't see it on the screen. All right, guys. So I think we got our marching orders. I had sort of structured the questions that I sent to you around Clay Christensen's framework around jobs to be done. I think it's a useful, somewhat simplistic, but helpful construct. It can be broken down many ways, but it does give us insight into how well you thought about your market segments, the granularity of how you plan to compete in that segment, and your attention to strategy to beat the market, which I think were two or three key points that Sarun wanted to go out. So let's start with that framework, but I would love to hear you guys answer that question with some of the pointers that Sarun pointed out. On my screen, I see Pamela to my immediate left, so I will start with you. Okay, tell you what, while we figure out why Pamela is muted, let's go to Tamir, because you're not muted.
Yeah, everyone tells me I like to talk, so all right. I could talk about this ad nauseum. All right, so I think the one thing that I would add to the slide before that you guys showed was really answering a real unmet need, and I'd like to start there. Because when we're talking about surgery and in general, I think the OR is the hospital's blind spot today. Kind of crazy because it's also the hospital's profit sanctuary. So, if we're thinking about this unmet need, healthcare systems today really understand outcomes, but they have very little understanding into what leads to them. And so variability, which is inherent in the way that we learn and practice surgery, is really the unacceptable status quo. So that's really, in a nutshell, our job to be done. It's to help healthcare systems surface what's actually being done in the operating room, identify and disseminate best practices as they are adopted, and improve the quality of care and financial performance of these institutions. And the way that we at Theator are doing it, yeah, go ahead, Dr. Bini.
No, I was going to say, it's very altruistic. How are you going to make money at it?
Yep. So the way we actually do it is by routinely capturing and analyzing minimally invasive surgical operative video, connecting the dots to the EMR. This is data that is lost on the OR floor on a daily basis. But by linking video, which is, again, what happens in the operating room, to patient characteristics and outcomes, we can actually generate value, which is ultimately what we're being paid for. So we surface the ground truth, and provide scalable observability and actionable ways to enable standardization of what is being done in the operating room, with impact both on clinical and operational aspects. So I'll give you just one example, real world example. So a department of gynecology knew it had a high injury rate to the ureter and hysterectomy. They didn't know why this was happening, and they obviously couldn't tackle it. Using our platform, we were able to automatically identify in a very scalable way whether or not a very common best practice was being adopted, deliberate view of the ureter. We have an algorithm that automatically identifies in a scalable way in each procedure automatically whether or not the surgeon is taking a deliberate look at the ureter. And what we found, which was new to the department, was that there is significant variability even at baseline. But going from there, and no one reached 100% of deliberate view of the ureter, but going from there, we were able to work together with the department once they realized that adoption rates were low for this best practice, and improved that over a period of less than 4 months. So we were able to improve surgical outcomes. We were able to improve patient safety, and we also demonstrated a reduction in operative time because procedures flowed better. I think roughly 13% operative time reduction. And so we were able to improve quality, safety, and enhance operational efficiency.
Okay, so Tamir, you've operated. So what's the task? What's the problem you're trying to solve? I mean, is somebody at that hospital looking to optimize those particular questions? Are they problems that came to ask, hey, we need to decrease by 13% of surgical time? It's not often obvious because that's not necessarily a required task, if I can ask.
So the task was enhance quality initiative. So a specific proactive approach to improving the quality of surgical care in the gynecology department, specifically around hysterectomy, because they had a higher than national average of injury to the ureter, which they couldn't figure out why that was happening. So in this case, that was a specific task. And in addition to that, we were able to demonstrate that we not only improve quality and patient safety, but we can also enhance operational efficiency and the finance of it. So there's obviously financial impact of a proactive approach to quality, which is completely different than anything that's being done today, when it's done in a scalable way. So the ability to enhance quality of care, patient safety, and minimize variability by standardizing best practices really has impact both on quality of care and how much money is generated in the operating room.
Okay, so you're processing video from the operating room, you're tying it to some of the data you're getting out of the electronic health record, you're using that information to optimize outcomes and processes to hopefully increase workflows and make money that way. Sarun, do you have any questions of him about that, to clarify that statement?
We can move on. Thank you.
All right. Yvonne, you're now next to me on my left. For those of you who don't know, Yvonne is a superstar in our world in orthopedics. She has had lots of very high-level roles at Zimmer Biomet and then working at large at the organizational level. So so great to see you getting your hands into startups. So tell us more about Alyve, and try to keep in context what we just talked about with Sarun's concepts, and also let's be clear about what people are hiring you to do.
Thanks, and thank you for those comments. That was very nice. So good to be here. I'm Yvonne Bokelman, CEO of Alyve Medical. Just real quickly, what does Alyve do? We're really addressing an unmet need in shoulder pain. So think about shoulder pain being one of the third most prevalent reasons individuals seek musculoskeletal care. It's a huge market. And so we've revolutionized the MSK rehab side of things with a product called Neuroline S. It's a therapeutic wearable, and it's really the next generation of NMES, or neuromuscular electrical stimulation devices. And what we've done is power that with a patented motion activated stimulation, or MAS, which is a completely different next gen way of doing it. And what makes it next gen is the fact that we're invoking a neuroplastic effect. So really activating the muscles at the point where we're retraining the brain. And in doing that, we're really addressing sort of sustained and optimal long-term outcomes. So when you think about us, we're kind of the extension of the surgery. We're the extension of the time in the OR in terms of being able to work in orthopedic rehab, so in post-acute care. And if you think about value-based care and how the focus has been on that post-acute side, and really being able to work and enhance the recovery, accelerate the recovery for those patients who've had reverse shoulder replacements, rotator cuff repair, have dyskinesia or posterior instability, all of those can be addressed with our product.
So Yvonne, you have a novel neuromuscular stimulation unit that enables us to accelerate the rehabilitation of the patient in very short terms, which is fantastic technology. But as with most people, when they pitch, they tell us what they do, but they don't tell us what problem they're trying to solve and why that problem is large enough to justify a $10 million investment, because the ROI is equivalent and necessary. So what is the unmet need, the problem, the job that we're hiring you to do that hasn't been solved by physical therapy, other devices, et cetera?
Yep. So we're really competing against physical therapy, right? That's the standard of care today. But what we've done, and what independent clinical data has shown, when you have PT and you stop, you actually regress. There's been no neuroplastic effect. And what we really need in orthopedics, because gosh, it's growing exponentially, right? The shoulder total market is $10 billion around the globe. We need patients to get the best outcome as quickly as they can and be able to sustain that over the long term. If you think about reverse shoulder replacement, those patients can begin to deteriorate. So how do you keep them optimally functional? So our problem is, let's solve for shoulder pain, let's solve for functionality, and let's do it in a way that's sustained over the long term. And let's do it in an objective manner that can be measured, because outcome measurement in orthopedics isn't always an objective.
So if I push back a little bit, it's like you've identified the lack of physical therapists, and not all PT are created equal. I mean, some people are more skilled than others, or they have specialties. As one's really good at the knee, but the shoulder is so unique.
Yep.
And you're saying we're addressing that market, but you say it's an international market, but for that to work, you have to have a whole bunch of infrastructure in place for your technology to actually be accessible. So I wouldn't say the entire planet's reverse shoulder market would be a reasonable reference point. Maybe if we just left the United States, and how does that scale?
So it's scaled both in the PT clinic, and the way we've designed for our product at the request of providers and PTs is to also be able to deliver it remotely, right? There's, like all of healthcare, resources are limited. There's limits to PTs, there's limits to hours. Patients have gotten a little spoiled. They don't want to come in and necessarily do it. One of the issues we're solving for is 75% of patients don't comply with the prescribed physical therapy. Yeah.
Okay, so that's the niche market you went after. You decided that within that space, the easiest one to tackle is the hardest one to do is shoulder, and that is how you get into granularity and you go into market. Thank you for that. I'm trying to give you guys about 10 minutes each, so we have a little bit at the end as well. Sarun, any follow-up questions?
Just curious on your perspective around scalability to other joints or post-operative problems.
I love you for that question. One of the things we've heard immediately is, because we're causing this neuroplastic effect and we see through objective clinical data, independent clinical data, that it holds over the long term, we were asked to go to the knee, right? Create something in the knee, particularly if you look at ACL and really needing to engage and activate the muscles there. So we have built a knee prototype. It is in clinical study. We expect to submit to the FDA before the end of the year and have that product on the market next year. So I came to the company because we cracked the code for shoulder, and shoulder is the most complex joint with the most range of motion. Knee is the huge market, 4 to 5 times what you have with shoulder. So to be able to take this to knee, next in the queue for us is spine, and there are already some preliminary work being done in that regard as well. So to your point, absolutely, we want to keep moving and where we can be effective.
Awesome. Moving on from neuromuscular plasticity, Nathaniel, tell us about your company, what problem you're trying to solve, why people hiring you to take on a task.
At nSight Surgical, what we're building is a parallel video healthcare record. We deploy camera networks to passively acquire data in the operating room that we real-time process in our AI stack. Then we deliver data back to OR staff via interface when and where they need it. That data spans 3 key areas: efficiency, cost, and quality. On the efficiency side, we distribute all surgical case operational information with our Kanban. We call those our case roadmap. We accurately track surgical phase times. We break a surgery with our algorithms into 9 separate surgical phases. We spot gap time. We help the hospital release unused block time, and we book additional cases so they can treat more patients in a day. The cost side, we track all surgical inventory. We document waste in each case, and we deliver accurate cost of goods on each surgery. On the quality side, we've digitized the surgical counting process, right? So we got rid of the dry erase board in the operating room. We're maintaining the surgical count. We track infection-related behaviors, like room in and out, cut time duration, sterile field violations. And we use machine learning to do comparative analysis on health outcome information and OR behavior. It's important to note that privacy is a really important thing, because Tamir is an awesome company, and we are both like using computer vision in different ways inside of the operating room. But we're looking at all of the operative staff. So we blur patient and operative staff faces and name badges, because it's really critical that we maintain personnel identity and keep that out of our network. We've built a non-discoverable data pipeline.
You're leveraging computer vision. Tamir was looking at the operation itself, extracting information from it. You're going outside the operation itself to the entire operating room. You're essentially, the task you're telling me you're taking on is that of every nurse in the operating room, our circulators that track the patients and make sure that nobody gets infected. Now, what you're talking about doing, the complexity of it should not be underestimated, right? You're talking about not just identifying people in a room and what they're doing, how close they're coming, proximity, which is, you've only got, you got multiple cameras set up in the room to create binocular vision. But we do have people who do that work, right? We do have a whole staffing model around it. How are you going to be more efficient than a highly trained nurse? Because that's the question about technology is it has to, at some level, be good enough to either replace or complement or augment the existing tools, right? That's the whole bit about this question from Clay Christensen is whose job am I hiring you to do, essentially? You've made it sound like it's easy, that you guys covered everything under the sun, but it is not so simple.
You're not wrong about that. It isn't so simple. I think the real core value proposition is when hospitals, most of the time, it's there's an initiative that happens where they're recording a specific amount of data on a certain thing. The problem is that falls off. So what we did was we looked to use assistive technology to support the surgeon and surgical assist to distribute surgical operational information. We can reduce training time that way with having Kanban in the operating room, because what that does is it exposes all of the tasks and all of the instrumentation that's required for each phase of surgery, and that's readily available. So Stefano, I don't know how often you actually have the same nursing in every single case, but Dr. certainly doesn't. And it's very helpful to not have to repeat that information to new nursing staff that come into the room. I think we've spent a lot of time on this. I'll be honest with you, this is the hardest thing that I've ever built. And so we spent a ton of time with a number of hospitals making sure that we had a product that would deliver on their value proposition in each area. And it was something that they wanted to purchase. So I think to be simple about it and end it, the thing that we can do is instead of your staffing cost being 10x, we can reduce those staffing costs down to 2x and to do it with AI.
So if I were to channel Sarun, I should ask you to channel yourself. See if I got it right. It's like, dude, you got to focus. You said, what are you going to go to market with? The entire OR seems like a big thing to tackle. What about just the instruments or just the nursing? Why would that not be a big enough task to tackle with this really powerful technology?
As a platform, we deliver on cost, efficiency, and quality. That same data, all of those camera feeds, we're able to deliver data in that way as a platform.
So your answer is, I don't have to focus because my technology can handle it.
I think it's one platform strategy.
Mark, do you have any questions? Yeah, I haven't asked you before, but I ran out of time before. I kept some time for you.
This is great. Keep it going. I think that, guys, I want you to focus on your product and really why you're different now. And, why you're different, you're seeing who your competitors are, all amazing companies. But why you're solving it, why do you think the problem you're solving is one of the biggest problems just in surgical transformation?
Yeah, one of the things to remember is that the cost of implementation is high as a rule. And when we get super hyper focused, sometimes the potential revenue generated by that solution is not as high as the cost necessary to implement it, even though it's a good solution. So it gets really tricky sometimes to make that case. Jeff, I'm going to ask you to make that case next.
Hey, Dr. Bini, and hello, everyone. Jeff LaConte, nice to meet you, VP of Marketing and Business Development at MMI. I spent a lot of time in robotics, and recently have made a move from a large company to a smaller company, MMI, as we have looked to completely reinvent a surgical robotic space. There are 9 million laparoscopic procedures done worldwide every year. There's 40 million that are done that are open. Vast majority of those open procedures are going to remain open. So things like flaps, head and neck, CMF, trauma procedures. There's been no robotic technology in that space to enable better outcomes or potentially better care. One area that MMI and the Samani robot is focused on is the opportunity to really enable greater treatment options for patients through a very, very small wristed 3mm end effector technology. There are 600 or less microsurgeons across the world. There's even fewer super microsurgeons that work in this plastic recon space. The Samani robot is focused on coming into market, focused primarily and initially in the breast cancer recon market. So our technology, we will work within breast recon initially, but there are many other applications for us where we can come in and solve what we believe is a really big unmet need and something truly that should be offered to all patients. So the way that the flaps work in the breast cancer recon market, of which there are over 1.2 worldwide mastectomies per year, is that a surgeon will create a flap for an autologous breast procedure, and we'll have to dig down deeper into the body to find the right size vessel to be able to create those anastomoses for viability of that flap. With the Samani robot, the surgeon does not have to dig down deeper into the body. They can use more of a perforator to perforator approach through the technology that eliminates tremor, that has a scaling factor in it, and we can, now create or have an opportunity to provide to the patient less trauma, less blood loss, less pain meds, et cetera, through an opportunity really to almost create a new approach to these flaps. So in some ways, for us, the way that we think about it is we're not just enabling treatment options, but we're in some ways elevating or enabling microsurgical skills worldwide. And we have the opportunity for us to provide this robot and this technology to facilities across the world to even expand microsurgical programs. So in some ways, we would be addressing the fact that there are limited super microsurgeon and microsurgeons worldwide, and we would be providing technology into these 40 million open procedures that many of them, as I mentioned before, will remain open for the foreseeable future. Beyond breast recon, our focus area is in lymphatics and the opportunity to have a big impact in lymphatics, whether it's a prophylactic lymphatic repair with the breast recon or the breast flap at that time period, or it's Dr. Bini, a little bit in your space as well, perhaps even some bone flaps and trauma, or it is, head and neck, it's hand surgery. It's the opportunity for us to bring a technology into these, I would say, more minimally open procedures that could be enabled through technology like Samani.
So today, those anastomoses are being done by trained surgeons.
Yeah, manual. Yep, absolutely.
Your technology essentially is simply to enable that anastomosis, that connection from one tissue to another, to happen with less skill required from the operator.
Correct. Yeah, less skill required.
Downstream of the anastomosis is a million different operations. You happen to have selected breast reconstruction as your primary use case.
Correct. Yeah, that's absolutely correct. So if you think about, what happens right now with these surgeons that are doing these procedures manually is one, there's a limited number that can do some of the vessel size that can actually enable lymphatics. There is a limited number of surgeons worldwide that can do the vessel size that could enable a perforator to perforator connection, more in mass scale globally. Then these surgeons, additionally, these microsurgeons really have to completely adapt their entire selves. They don't go to the gym. They don't drink coffee. They certainly don't drink, the night before. They do everything that they can to eliminate that human tremor. And that human tremor starts at about age 40, gets a little bit more aggressive at age 40, all natural, but it happens to everyone. And in some ways, this actually enables really the opportunity of care and the longevity of a career for a surgeon as well.
This fits more into the medtech category than digital health, as in apps and that sort of thing. As device marketing is tricky, right? Because it's hardware and you have to get it through the markets and then acceptance. And assuming you've got all the clinical data behind it to support that it's used, and it's actually as easy as you make it sound. What is going to be your biggest challenge to getting this into the market, or I presume to be acquired by one of the larger vascular companies?
Yeah, so we're in Europe currently. We have 16 systems. We just celebrated our 500th case in Europe. We're aggressively moving forward with and toward approval in the US. But as you know, the biggest obstacle for any company in this space coming into the United States is ensuring that you have the right commercial model and deal structure to enable the opportunity for the company to make money and for surgeons and facilities to be able to have access to it. So I see that as likely our biggest obstacle, not insurmountable. Especially as we have an opportunity, I believe, to even, help to create new line items of business for hospitals, maybe most notably around lymphatic repair, and perhaps even, idiopathic lymphatic repair or acute lymphatic repair. So I see that as probably our biggest challenge.
Sarun, and Mark, while Sarun's answering his question, you take a look at your text message I sent you. Sarun, what thoughts do you have?
I don't know. I think that was very helpful. No additional thoughts for now.
Great. All right. So we've actually got quite a breadth of technologies as we're learning in this space that are helping to drive forward the digital transformation of orthopedics, of surgery in general. So moving on to Dr. Barad, Justin Barad, CEO of OSSO VR. Justin, I'm going to ask you the same question we've been asking everybody else. What challenge, what problem is OSSO VR trying to solve? Feel free to give us a little background on the company, but let's make sure we focus on this question of what are we hiring OSSO VR to do in the operating room or in the hospital system?
An honor to be on here with all the fellow panelists. And Yvonne, hi, it's been a while. Good to see you. So, my background, I'm a former video game developer turned orthopedic surgeon and, saw firsthand what I think is the biggest challenge we have in healthcare today, which is how we train and assess healthcare professionals with procedures and surgery. So to give you an idea of what's driving this problem is really, I see as like four things. One is there's really just too much to learn. You think about it, accelerating science and technologies, expanding the library of procedures. We as proceduralists are expected to know how to do sometimes on demand with little notice. The second part of the problem is modern surgery is really complicated. Surgery has always been relatively complex, but the learning curves have gotten a lot longer. And so most modern procedures, whether you're talking about minimally invasive approaches like an anterior total hip or minimally invasive spine, or most robotic procedures, have a learning curve of 50 to 100 cases, which can be about 10 times harder to learn than traditional open procedures. The third part of the problem is we really lack an objective way to assess surgical skill or procedural readiness. So in my entire career, I don't know about you, Dr. Bini, but the only time I've been formally and objectively evaluated, I was asked to play the board game Operation. And remove some pieces of that buzzing. I guess my tremor was okay, Jeff, at that point, but probably couldn't do it today. I don't know. I might need your robot. The fourth part of the problem is surgery is more and more, much more of a highly coordinated team sport. It's not just the surgeon coming in doing the surgery. There's a lot of people involved. And in the environment today, there's a lot of churn. You're working with different teams, often new techs and nurses maybe that have never done a surgery before in their lives, and you don't really have the ability to practice and rehearse as a team. So what does the data show? So I won't go through everything, but as of 2017, 31% of graduating residents could not operate without some kind of supervision. We are projected to be 23,000 surgical specialists short by 2032 by the American Association of Medical Colleges. And in a groundbreaking study from Berkmeyer in the New England Journal of Medicine, this is for bariatric surgery, but the mortality rate was 5 times higher in lower skilled surgeons than their higher skilled counterparts. We know that there's a significant effect on the 300 million procedures that are performed around the world annually. So what is OSSO VR? OSSO VR is an anytime, anywhere surgical training platform that leverages spatial computing, which is the term du jour of VR and XR technology. We use a $300 headset that you can bring with you, smaller, lighter, and textbook, and you could train on any procedure using your hands and get objective assessment. You can also train as a team and coach people remotely. We're the world's largest VR surgical training platform. We train around 5,000 healthcare professionals per month. And I think most importantly, it works. So we now have 8 peer-reviewed studies that have been published on the platform. Once again, I'm not going to go through all of them with you, but just to give you some highlights, one study performed at UCLA in the Journal of Surgical Education showed that when comparing 2 groups, one trained with OSSO to a measured level of proficiency with a traditional training group. The performance as measured by something called the global rating scale improved by 230% or 10 points. And what's really interesting is the two groups came back in 2 weeks after that evaluation to get reassessed, and there was an even bigger difference in favor of the VR group. So there's a real long-term effect of this type of training. The other study I want to point out is a study published in the journal Core, which is one of our top 3 journals in orthopedics. That study found that when comparing VR with traditional training, the VR trained group was able to complete a procedure at a rate of 78%, meaning that 78% of that group could complete a procedure without needing someone to step in and help. In the traditional training group, it was 25%. So about a 300% improvement there. Once again, across the board, we're seeing improvements. And I'll just share, like, what's the potential impact? What's the potential value here? I'll share one anecdotal case study we have. This is not published data, but I think it shows the potential of this technology, where we took one surgeon who is a fully trained surgeon out in practice. You could relate to this, Dr. Bini, joint replacement surgeon, fellowship trained. He's a posterior approach surgeon, and he wants to switch to an anterior total hip. That takes 50 to 100 cases. That's what the data has consistently shown us. So he operated on an individual on the right side. It was a difficult case. It took about 3 hours and 30 minutes. You know, ideally, you really want to be between 1 to 2 hours, if not faster. And that was about case 7 for this guy. And he then started training in OSSO VR over about a 3-week period, did 6 hours of training, 90 sessions. And what's really unique about this, probably never will be able to replicate this again, operated on the same patient, just a contralateral hip, the exact same level of difficulty. And that side was 1 hour and 45 minutes, or twice as fast. And, you know, in my mind, I expand that over 300 million surgeries performed per year. And if we can improve the performance 200%, increase the ability to perform surgery independently 300%, cut surgical time by half, that is such immense value delivered to our healthcare system. And how you capture that and the business model, that's, you know, a whole other question, and I welcome those. But we are very excited to democratize access to a highly effective form of surgical training that can level the playing field for us as healthcare professionals, but more importantly, patients.
So thank you, Justin. So you've taken virtual reality, and the problem you're trying to solve is training and access to training. And then the downstream effect of that is quality, time, costs, all those things are improved. And in that context, so the problem you're going after, the problem statement, the task, would it be fair to say that the task we're hiring OSSO VR to do is to train surgeons to do a better job, simplistically speaking? Or would you qualify that a bit?
I would say a better job. I would say a proficient job faster. So there are really 2 areas where we focus. One is on formal training, so residency and fellowship, mainly today with interventional specialties in orthopedics. And so we want to accelerate the creation of consistent quality proceduralists, so interventional cardiologists and orthopedic surgeons. On the other side is allowing surgeons to get more facile with new technology faster, so we can accelerate the adoption and get these higher value technologies like what Jeff is building to patients proficiently. And the issue is that the training is so complex that going to a single cadaver lab and then bringing the technology in, you are not yet safe enough to perform a procedure. And what ends up happening is the administration, the surgeon ends up being like, whoa, this is unsafe. Let's wait a few years to adopt this better technology because it doesn't feel like we can do it effectively or efficiently or safely. When in fact, they didn't have access to enough training. And also they didn't know when they're ready, because there's no objective marker right now of like, hey, this surgeon is ready to use this robot. I am ready to use this minimally invasive technique. It's all a judgment call. We're just like, hey, I think I'm ready. I feel like this person's ready. And adding in that objective data allows for a much more consistent adoption and application of this technology, even in clinical trials where this is starting to be utilized at a greater rate.
So Justin, I couldn't ask this of the other people here because they're all extremely unique, but you actually do have some competitors in the market. So one of the questions that Sarun was asking at the beginning is a question about special sauce and defensibility, and what makes you guys so amazing, or more amazing than the competition?
If anyone doesn't have any competitors, something's wrong, right? Everyone in this room has competitors in the market, and that's how you know you're in a good market. So we are the market leader. We're the world's largest VR surgical training company. And our special sauce is the level of validation of the platform, the volume of adoption, training around 5,000 healthcare professionals a month, the size of our content library, which is over 200 modules in almost every specialty, and many aspects of the technology, which, I mean, we don't have enough time to get into little components here and there, but I'd say that one of our calling cards is the stunning clinical accuracy of what we've been able to develop. At OSSO, we have the world's largest medical illustration team. We've got over 40 medical illustrators as a company. I think the Journal of the American Medical Association might be the next largest team, and they have about 12, to just give you a sense of the order of magnitude. And that's led to us creating a library of anatomy that even some of our partners, whether they're healthcare institutions or large medical device companies, tell us that this is more accurate than what we've been teaching before, like the level of subtlety in the anatomy and the interactions of what we're creating. So there's a lot that goes into it in terms of differentiation in the market, and a lot around supporting the deployment of VR as well. You know, you can't just like lob it over the fence, but I think that is what has led to our success today.
Well, congratulations on getting there, and thank you for the answer. And again, I'll turn it to Sarun and Mark if you have any quick questions, and then we'll go to, not Pamela, but Ashvin. All right, Sarun, thoughts?
That was fantastic. Thank you, Justin.
Great, great work. Okay, well, on our screen, we have Pamela Singh, and she is, she's actually Ashvin. Dewan is an orthopedic surgeon. He's helping take this call today on CaseCTRL. So I don't know if you were there at the beginning of the call. Yeah, we talked a little bit about trying to answer this question: is what is the task you're being hired to complete? And Sarun gave us some really good high level perspective on how they would judge a company's ability to succeed. Everything from strategy, how to read the market strategy, how the strategy allows them to take source of their particular take advantage of their particular skill sets, which we just asked Justin to talk about a little bit, and the granularity of where to the specific understanding well enough the market you go into to be granular about where you're going to attack. So if you could give us a little perspective on CaseCTRL, that'd be great.
Yeah, absolutely. Thank you guys for having us. And Pam sends her apologies, she's having some technical difficulties, so I stepped in. You know, the problem we're trying to tackle is we're trying to automate and streamline the surgical coordination and preoperative preparation process for the patients. We want it to be as easy as booking a reservation on OpenTable for a restaurant. As most of you guys panelists know, there's a lot that goes on behind the scenes, but we are creating the infrastructure and the platform to automate that. And we're using AI to kind of help us make a lot of predictions about the best surgical plan, and then using the surgeons to validate that. And then that allows the system then to go and independently start getting the surgery orchestrated behind the scenes. Primary, I think where we really stand apart, I think from some of our competitors, is there's a lot of folks out there that are trying to optimize the surgical event. But we get in where it starts in the trenches, in the clinic. The moment a patient is recognized as a potential need for surgery, or they use our system to book the case. And what we do really well is, instead of having like a 8-page static form in their EMR to fill out all the details, which no one ever fills out, CaseCTRL uses historical surgical preferences and other patients in similar contexts to present to the surgeon on a gold platter all the different specifics of that surgical episode, whether it be preoperative planning, you know, labs, clearances, equipment they want to use, vendors they want to use, you know, all the way to postoperative specifics, like when they want the dressing taken down, when they want the physical therapy to start, when they want certain types of DME, so that when they approve the plan, the system then can go to work behind the scenes, automatically engaging all the stakeholders, making sure that the management is done appropriately, and also then allowing us to make sure the cases are prepared for the OR. I think the second part to your question, talking about a little bit about go-to-market, I think that was your second part. We have initially started off kind of out of an organic need. You know, it was my own practice. I have a software engineering background before I came into the entrepreneurial space, and I kind of saw that I could do surgery with a robot this day and age, but I still struggled to keep tabs of all my surgical candidates. And so started off more as an MVP of my practice, I didn't think of it as a business, but then my partners noticed the difference that my practice was making, the fewer FTEs that I required to schedule surgery. And that's kind of like when the light bulb went off. And so since then, we initially started in orthopedics because that's where we're initially comfortable with. Kind of started growing from word of mouth from that perspective. And we soon realized our ideal customer was actually the practice administrators, director of operations, chief operation officers. And so we've been gradually working on getting bigger groups and also expanding into other specialties.
So surgical coordination through the use of intelligent interfaces, and there's tons of stuff you can do with generative AI once you get going in that space. But thank you for that. I want to give everybody another minute. We've 8 minutes left. There's 8 of you. You've listened to everybody else have a say. There's this one thing you wish you'd said. So I'm going to give you guys that opportunity. I'm going to go to Yvonne first. A minute to remind us why you are the winner, should be.
Great. I think that, again, building on what's been said, Alyve Medical is bringing to market a tool that can really objectively help manage post-acute musculoskeletal care and rehab in a way that has not been done before. And in doing that, we are really transforming and enhancing the standard of care. It's not a complete displacing of anything, but an adjunct, an improvement, an addition to what's been done previously that builds upon and improves outcomes for the sustained long term. So for us to do and change that standard of care, that's a big lift in today's world. And so having the honor of being in this group, of being potentially recognized by this group would go a long way in terms of getting our message out and creating more visibility. So appreciate it.
Thank you, Yvonne, for a succinct statement and keeping it to a minute. Appreciate that. Okay, Tamir, you'd love to talk, so it'll be harder to keep you to a minute, but I will try. Your turn.
Oh man, I've got team members on this call as well. Okay. So in a nutshell, theater is really disrupting the status quo. We're reimagining the entire field of surgery. And we're doing it in a way that caters to multiple stakeholders within the healthcare ecosystem. I think that data is a key driver of innovation in surgery in the next several decades. But already today, and really for the first time, healthcare leaders have visibility into what is actually happening in their operating rooms. Clinical leaders and surgeons have actionable ways of tackling quality issues and safety and operational efficiency and continuously improving. So it really is what is happening in the real world. So ultimately, I think we're reshaping quality, we're reshaping safety so that it's routine, it's scalable, and it's proactive. And we're augmenting how surgeons think of best practices, both clinical and operational. We're redefining how training is performed and how quantitative feedback, objective feedback is provided. And we're also on our way to moving around OR documentation ultimately so that it serves not only billing, but patients and obviously surgeons and administration. And all of this on the way to real-time decision support, but we are extremely focused. Everything is intracorporeal, everything is intraoperative video. We're not adding sensors, we're not adding anything. It's the hardware stack that's already in the operating room, and we're adding a layer of surgical intelligence to that. So why is this important? In a world in which where you live determines if you live, only standardization and dissemination of best practices will really make a dent, and that's theater.
Thank you for telling us about theater. Good luck. Nathaniel, let's talk more about nSight Surgical.
So the one thing that I want to follow back up on was your push on focus. I think where focus came for nSight Surgical was thinking about the marketplace as specific customer segments. So for ASCs, we have a focus, which is cost. We showed them all of our other portfolio, and that wasn't something that they were interested in, but they really needed to understand their cost of goods of surgery because they get paid half of what a hospital gets for the exact same case. And we're going to see, we're already seeing a lot of scale happening in the ASC marketplace of where surgery is going. As far as hospitals are concerned, they wanted a different thing. And so that's where our portfolio opened up. But the biggest change mover in the hospital is our ability to get extra cases in a day, because that is the profit driving center of the hospital. And I think as I look at the business and I think about it from a product point of view, I start to see it as a platform strategy of cost, efficiency, and quality. But segment is how we've created focus inside of what we're doing at nSight Surgical.
Outstanding. Jeff, you're up next.
Thank you. So with Samani, we are addressing real unmet needs. It's not technology for technology's sake. It's not a robot for a robot's sake. There is a gap in open surgery, and there is a gap in the opportunity to create more microsurgeons and super microsurgeons. There's an opportunity to create a new standard of care in how we're performing plastic reconstructive surgery. There's an opportunity for us to be able to address the way that a surgeon carries themselves and carries their lives through all of the training they put in. And then, getting to a situation where they're operating and, then they're quickly thereafter reaching a particular age where something like a human tremor, begins to take a little bit more aggressive hold naturally. For us, it's really about enabling patient care. And when we think about something like breast reconstruction and the number of breast or mastectomies that are done every year, and the focus that's been put on breast cancer and breast care for so long, there really is an opportunity for us to enter that particular space and provide a new standard and a new opportunity that can, really take this even one step further and allow for a patient to have less trauma, less blood loss, less pain, faster recovery, better presenteeism, opportunity to get back to their standard and quality of life as fast as possible. And from there, it continues. So one of the big opportunities that we still feel that we have is to really make a microsurgeon a super microsurgeon, and in some ways, maybe even a breast surgeon a microsurgeon. And we have technology we strongly believe and has been shown with the growth we've seen in Europe to enable that. So
awesome. Thank you very much.
Congratulations to all the competitors for being here, and thank you to the panel.
Excellent. Microsurgery. From microsurgery to virtual reality, Justin.
The winner of this very prestigious competition should both show a huge potential opportunity when it comes to addressing all procedural care for patients everywhere, but also a track record of success, the company that has shown the ability to execute. Dreams don't mean a whole lot if you can't get a lot done, unless we're talking about our healthcare ecosystem as a whole. And I think that's where the story of Ignaz Semmelweis versus Galen versus Vesalius really comes to mind. I'm not going to get all the medical history, but Vesalius was able to overturn 1,000 years of stale medical knowledge through the power of art and a visual medium and inspiring people to think a different way. And I think winning this competition in our sort of surgical space with such a visual product and something that is so immediately obvious and exciting is a way to continually generate interest that we badly need from investors, from hospitals, from us as healthcare professionals, and most importantly, patients. And we want to continue to demonstrate to the world why it's important to pay attention to healthcare technology, to do the work, to validate it, to implement it, which is the hardest part, as you said, Dr. Bini, and to change everyone's lives. But it takes everyone as a village. And I think it is, at the end of the day, you can have something that works and a lot of data that shows that it works, but you need that will and that inspiration and drive to get it done. And I think we tell that story extremely well.
Thank you, Justin. We have 1 minute left, and I give it to you guys. CaseCTRL, please, Ashvin, 1 minute.
At CaseCTRL, we envision a fully autonomous, personalized surgical care delivery revolution, and where fast, efficient surgical care is accessible to all in a matter of seconds, and instead of what now takes days to weeks and an army of behind-the-scenes staff. What we're doing is we're giving patients ownership and accessibility to their care, helping surgeons drive better quality and quantity of surgery, and really getting back uncompensated time, and giving schedulers and staff back their sanity with the elimination of a lot of the administrative burden and work. Building for surgeons is hard, and this field is littered with those that have failed before us, but we are purpose-built by surgeons, for surgeons and teams, and currently can't keep up with our demand, and excited to transform the way surgical care is coordinated and delivered. So thank you to a great batch of competitors, and a great opportunity and platform to discuss our innovations.
So with that, we're going to turn it back to Mark. We're going to see you guys at the award ceremony in Las Vegas. But Mark, to you.
So look, this is what was the objective of the last hour plus? We basically set you up to explain it, but what you said at the end was really what our judges want to hear. Why are you different? Why are you great? And why are you making a difference? Stefano, you did an amazing job. Thank you, McKinsey. thank you all. And you will get a notice once this edited version is live. It's going to go social, and all the judges are it's going to first thing they're going to look at. So thank you very much, and have a great rest of your day.
At Alyve Medical, we want to really change that paradigm of musculoskeletal treatment, and in doing so, increase functional and mobility for anyone with shoulder issues, be it prehab, rehab, or maybe not even a surgical candidate. In addition to solving for the shoulder issues, we have 3 other musculoskeletal problems we're solving. Today, there are no therapies or devices that really retrain the brain or cause that neuroplastic effect. And that's really what allows for the optimal restoration of movement and the sustained long-term outcomes. Additionally, healthcare providers have a really challenging time assessing motion patterns and orthopedic outcomes in an objective manner. And lastly, 75% of patients don't comply with prescribed physical therapy. It costs the healthcare system a lot of money, and in orthopedics, which has exponential growth, we're obligated to try to deal with that issue. So at Alyve Medical, we have 2 products that we think deal with all of those problems. The first is our therapeutic product called Neuralign System S, the S for shoulder. And you can see in the picture the gentleman who has the device on his arm as well as the companion tablet. And with that, you get trimodal biofeedback, which really addresses that compliance problem that I mentioned. But what's most significant is the fact that we have a patented algorithm that offers motion-activated stimulation. And that is a real difference that no other product on the market has today. If you think about stimulation devices that have intensity pre-programmed and are time-based, this is nothing like that. This device allows for dynamic, personalized interaction while doing a course of exercises with your physical therapy. Our second product is a diagnostic. It's called Show Motion. Essentially, our customers refer to it as a gait lab in the box. It really assesses joint motion abnormality or normality within 5 to 10 minutes. It provides an instant graphic display that allows a healthcare provider to take action, and it's mobile and can be used anywhere.
Every year, surgeons leave up to $500K on the table. Why? The surgical scheduling process and its complex logistics are holding practices back. As an orthopedic surgeon, I was shocked to find 35% of my surgical candidates did not make it to the operating room as planned. At the nexus of this problem are surgery schedulers. Juggling many stakeholders and cases leads to burnout and suboptimal care. For patients, surgery is an equally stressful time with an average of only 10 minutes in the clinic to digest the encyclopedia of information I provide for their surgeries. There has to be a better way.
Introducing CaseCTRL, the perioperative surgical coordination platform that uses AI to automate surgical workflows, increase surgical case volume, and reduce costly complications, ultimately enhancing patient and surgeon satisfaction. It can integrate with your existing EMR or function as a standalone application. It starts with Case Builder, our AI-driven point-of-care clinic tool that synthesizes over 150 data points needed to help surgeons craft a complex surgical plan in seconds, eliminating dependency on surgeons. Over 40 automated messages coordinate stakeholders, such as vendors, anesthesia providers, and insurance, meaning what used to take 4 hours of work now takes schedulers only 1 hour with CaseCTRL. For patients, the red carpet is rolled out with automated just-in-time texts and emails to guide them on their surgical journey. You can't fix what you can't see, so collaborative HIPAA-compliant dashboards show progress of all surgical candidates in the pipeline, ensuring no case is left behind, including those impacted by COVID. Predictive analytics risks stratify patients to mitigate complications and cancellations. The net result? Up to $400K more in annual collections per surgeon due to 20% increase in surgical volume, 300 plus surgeon hours reclaimed, less time to schedule surgery, and happier and healthier patients. With personalized and accessible care, CaseCTRL gives your practice a competitive edge.
everybody. My name is Jeff LaConte, Vice President of Marketing and Business Development for MMI. Question number one, what is your solution? MMI in the Samani surgical system is the first of its kind robotic technology that uniquely addresses the scale and complexities of microsurgery and super microsurgery, which involve repairing anatomical structures such as veins, arteries, nerves, lymphatic vessels that can be as small as 0.3 millimeters in diameter. For context, that's smaller than a few strands of human hair. The Samani surgical system provides motion scaling, tremor reduction, and we use our proprietary nano wrist micro instruments. These have the smallest surgical robotic wrist available today. Second question, what is your superpower? Well, the Samani surgical system helps to restore quality of life for more patients, and it enables hospitals to open and expand surgical programs. Right now, there are only 600 or less super microsurgeons worldwide. And by increasing access to microsurgical procedures and raising the standard of care across microsurgery and super microsurgery, Samani has the potential to increase the rate of positive health outcomes and minimize the need for hospital readmissions and second surgeries following potential complications. We believe that we should win because at MMI we are pushing the line of complexity to make previously impossible surgical procedures now possible. Thank you very much for your consideration of our submission.
nSight Surgical is the first artificial intelligence platform using computer vision to objectively document healthcare information. My name is Nathaniel Smith. I'm the CEO of nSight Surgical. I assembled this multidisciplinary team to build operative intelligence. In 2021, my mom had a surgical site infection that caused her kidneys to fail. There's 6.6 million surgical site infections globally. 3% of those are fatalities. We plan to impact both of those numbers by 40%. The quality of the care that you receive and the transparency of information are what's at stake in what we're building at nSight Surgical. In the US, your healthcare costs you $4.3 trillion today. Inside of this web, we found a $505 billion blue ocean data opportunity to reduce what is wasted in surgical care. Today in healthcare, we depend on subjective data like surgeon opinions and operative notes. We're building a parallel video healthcare record based on truly objective data that can save the average US hospital $4 million. nSight Surgical is an artificial intelligence platform with a software as a service pricing framework. In a weekend, we can retrofit an operating room with our zero footprint design. We install an interactive digital whiteboard that delivers data to staff when and where they need it. We use computer vision to collaborate with staff on patient care related needs, like infection related behaviors, tracking needles, the smallest instruments in the OR, which no one else in the world can do, along with many other instruments, surgical phase times, and distributing surgical operational information. Our proprietary metrics help hospital administrators incentivize team performance so that they can focus on revenue generating efficiency. This is our first operating room, Tulsa, Oklahoma, at the Oklahoma Surgical Hospital. We have active sales relationships with one of the largest med device manufacturers in the US, term sheet signed under NDA, that will deliver 55 ORs this year, and we're on track to deliver over 100 ORs. The chairs of surgery at prominent institutions like Cleveland Clinic, Hospital for Special Surgery, Kaiser, and Stanford all believe that nSight Surgical is the future of surgery. I believe that objective data is our future. We're 3 years ahead of all of our competitors and the largest med device manufacturers in the world. We are the only solution that can advance healthcare in this modality as we know it today.
Hi, my name is Justin Barad. I'm an orthopedic surgeon, the co-founder and CEO of OSSO VR, the world's largest VR surgical training platform. We feel so privileged to apply to the UCSF Digital Health Awards, and we're incredibly excited to share what we're working on. At OSSO, we're trying to solve a very simple challenge in healthcare, how we train and assess our healthcare professionals in procedures and surgery. The problem is there's too much to learn. Modern surgery is getting harder to learn and more complicated, and we lack a way to objectively assess surgical skill. OSSO is an anytime, anywhere training platform using off-the-shelf VR technology that allows you to objectively assess yourself and also train as a team and train remotely. We have over 200 training modules, and we have 7 peer-reviewed studies showing we can improve performance 200 to 300%. What's our superpower, you might ask? Well, that's our mission. Our mission is to improve patient outcomes with better education and assessment, increase the adoption of higher value surgical technologies and techniques, and democratize access to surgical training for everyone everywhere. And we're especially excited about our new product, OSSO Academy, which is a direct-to-residency and fellowship program platform designed to supplement ACG case minimums and technical milestones. Why should we win? Well, I'll say 2 things. One is impact, and the other is inspiration. There are over 200 million surgeries performed every year. Imagine each and every one of those is performed to its maximum potential. That's an improvement in healthcare delivery that's very rarely seen. But it doesn't happen automatically. We as healthcare professionals need to start using these new technologies. We do that by being inspired. At OSSO VR, we're using the power of art and Oscar and Emmy Award-winning artists to drive change when we need it most. Thank you so much for this opportunity.
Our goal is to standardize best practices. Today we're just laying the foundation of how can we capture everything and measure what will be the next standard of surgery. I believe that in the next 5 to 10 years, we will be the one that leads the gold standard of how you need to do surgery, because it will be all validated and measured with hundreds of medical centers around the world. And I believe that this will completely change the way that surgery is being done today.
There are amazing data insights from an outcomes perspective in surgery. We know the what happens afterwards. There's zero understanding of process, and that's exactly what we are starting to do, which is basically shed light on process in the operating room, understand what is going on, so that we not only know the what happens, but we know why it happens. And then we're actually going to be the intelligence, the surgical intelligence that drives robotic platforms. We're coming with something that's so super innovative within an outdated, archaic, and highly regulated environment. And to just see the light bulb suddenly flash when you have a conversation with someone within the system and they understand what you're talking about and they say, wow, this is how we can actually improve care, improve the quality of what we're doing on a daily basis. This can actually help us and our patients. I think that's also extremely fulfilling. Ultimately, we're in this to save lives. And I think that's exactly what we're doing.